Hey guys, Tony Maritato here. So I wanted to answer Sandy's question. So Sandy was asking if I had any advice on how physical therapy works, what to expect from physical therapy. Do we as physical therapists follow the doctor's orders? Do we switch things up? Every place is different. She's going to a place right now. She's been there for 3 visits and she's seen 3 different therapists. She said, quote, they only work on the machines. She's only been checked for progress on the first visit. When she asked about her pain in the muscles, she was asked by the therapist if she tried heat or ice and was suggested to try to move the kneecap and could do a little massage. Okay, so let's talk about what you can expect from your therapy experience. Now, I'm the first one to say, obviously I'm biased as a physical therapist and a practice owner. I have a very specific patient experience that I try to provide all of my clients who are referred to me. That being said, you're kind of out there not really knowing what you're going to get until you get it. And I think that's the biggest barrier to people getting the most benefit from physical therapy is right now, the way the system is set up, you're not really going out and choosing your therapist. You're not interviewing them. You're not looking at reviews and bios and trying to pick the perfect therapist for your particular condition. Typically, what's happening is the doctor is saying, okay, go to physical therapy. Maybe they give you a list of 2 or 3 places, and then you go. And you have no idea what you're going to get, who you're going to work with. And I can tell you from being in the profession almost 20 years, there are therapists that do exclusively hands-on soft tissue massage. There's a therapist that do exclusively exercise. There's therapists that'll do dry needling, that'll do other modalities. Like every single one of us is completely different. Even within my organization, the team that I work with, other clinicians, PTs and PTAs and OTs I've worked with, although I respect and have the utmost confidence in their ability, we are all different as well. So you really need to, in an ideal world, if you have the opportunity, take the time, research who you're going to work with, research their ideas, their philosophies, like why did they become a therapist in the first place, and then be clear with your expectations. So in this case, Sandy, as a physical therapist myself, I do think manual therapy is an important component of the rehab process. Whether you're looking at manual therapy as a way to reduce pain, whether you're looking at it as a way to increase range of motion, I think 100% a patient who had a total knee replacement could get just as good of an outcome, even if the therapist never touched their leg, but I don't think it's as enjoyable. I don't think it's as pleasurable. I don't think it's as good of an experience for you, the patient. So while you may, and I know patients who don't want me to touch them, and that's totally fine. Like that's the patient's decision that maybe they don't like being touched. They don't like the massage on their calf and their thigh, and they don't want a therapist's hands on them. They just want the exercise. That's great. Find a therapist who focuses on exercise therapy. If you're the kind of patient who wants more of the manual experience and a therapist to touch you and help you with the stretching and the mobilizations and the things that we do, find a therapist who does that. Now, I would say that you are absolutely well within your rights as a patient to tell the therapy scheduler, the clinic, whoever you can talk to say, look, I want to work with the same therapist. If you can't provide me, and you can be, you as the patient have to be a little flexible with your scheduling to say, I want to work with this one therapist. And if I need to come earlier or later or on certain days, I'll do it. But I only want to work with one therapist. And there's a lot of benefit to that because once you find the therapist that you connect with, that you trust, that you build a rapport with, you're going to progress a lot more quickly, more effectively, just because you guys are connecting. Now, as a practice owner, I can tell you it's not always easy to schedule the same patient with the same therapist. But that being said, if a patient came to me and said, I want Joe or Tony or Bob or Larry or Sandy or whoever, I'm going to make that work because your overall patient experience is more important than anything else that we can provide. And if you find a therapist, now there is benefit in the beginning to seeing different clinicians, because you can be like, well, when I worked with that guy, he really pushed me. When I worked with that one, I didn't feel like the time was well spent. Okay, you're going to go with the first one. But if you don't get to experience the different personalities of the clinicians, then it's hard to choose who you're going to work with. So just like anything, you're hiring that therapist as part of your rehab team. You've got a surgical team, you've got a rehab team, hopefully you have a support team at home. And so if you're not 100% confident in the therapist's ability to get you to where you need to be, to do the things you need done, then you need to just keep looking. And so I know it's easier in the US. We've got a lot of patients overseas who have a hard time kind of being able to pick and choose who they're going to work with. But whether you go to a hospital outpatient physical therapy clinic, you go to a private practice, I would absolutely say, one, it's well within your right to choose one therapist that you want to work with and stay with that therapist. Two, if the facility can't accommodate you on that, find another facility. There's therapists that work for the hospital, like I already said. There's therapists that are in private practice. And then there's what we call mobile therapists. These are therapists that can come to your home. If you have Medicare or other non-Medicare payers, you can check your coverage and see if they're contracted with them. But one of the things that I used to do, and I've started to do again as a Medicare provider, is Medicare covers outpatient physical therapy either delivered in a clinic or in your home. So in those first couple days, couple weeks of, post-surgical care, you're not driving. It's hard to get transportation sometimes. An outpatient therapist can come to your home to initiate physical therapy. It doesn't have to be under Medicare Part A home health. It could be under Medicare Part B, delivered in the home. And then when you're ready to go to an outpatient clinic, you can transition sometimes with that same therapist into an outpatient clinic. But, what to expect from your experience, I think the first thing is you have to trust your therapist. You have to find someone that you like. Your personalities have to work well together. I know amazing therapists who don't work well with certain personality types. And so if you were my mom, my sister, my brother, related to me in any capacity, I would tell you, look, pick the therapist who you first like personally, then who you know and are confident can get you to your goals, and they can push you when they need to push you. They can take it easy when you need to take it easy, but that together as a team, you're going to get to where you need to be. And if this particular clinic or therapist can't do that, you find another one. If they can't do it, you find another one. There is no limit to the different therapists you can kind of work with and experiment with. If they do an eval and you don't like it, go get another one. You can get another evaluation done. And if you don't like that one, go get another one. If you don't like the third one, reach out to me. We'll do it through telehealth. I'll make sure you get what you need. But I want you to feel 100% confident. And when you find the right clinician, it just clicks. It just clicks. You're confident. That they're going to get you to where you need to be. Whether you think of them as a coach, as a cheerleader, like we fill different roles at different times for different people. But no matter what, you have to feel that full buy-in and know that you're doing the right thing. And the fact that you're asking that question pretty much tells me you're probably not at the right facility or not working with the right clinician. So I'd encourage you to keep looking, but if you need any other help, reach out to me. You can message me. You can post a comment in the video. I hope that answered your question. And guys, anybody who has questions about total knee replacement, rehabilitation, or anything pre-op, post-op, let us know. The more questions you ask, the better content we can produce. All right, guys, have a great day. Thanks for watching.